Spilling the Beans digital health podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia and the United States. The podcast is available through all major podcast distributors as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and Woodrow Mercer Digital Health.
Hi everyone and welcome to Spill the Beans. My name's Duncan Goldie. My guest this week is Benjamin Lee, who's a freelance product consultant from New York. Ben has recently written a series of blog posts around the healthcare landscape and how healthcare data is a bit of a bottleneck, and how that's impacting, I suppose, the whole healthcare industry in general. So I caught up with Ben and kind of talked through this blog post and the points that he raises in a bit more detail, and also just kind of went over a bit of a snapshot over what his view of the healthcare industry is globally. So really interesting to get a difference of opinion coming all the way over from the States and the issues they might be facing there versus what we've got here in the UK. And also in our previous podcast series, as you would have heard, we've got people from Australia involved as well. So it's really good to get an insight into this. So I really enjoyed chatting with him and I hope you guys do too.
Hey Ben, thanks so much for taking the time to chat with me this evening UK time and this afternoon American time. So tell me, whereabouts in the world are you right now?
Yeah, Duncan, I'm happy to chat. I'm currently based out of New York, where it's kind of the epicenter of the pandemic, but I'm safe and sound in the outskirts in kind of Long Island right now. And yeah, crazy times we're living in, but obviously health tech and healthcare is at the forefront of the focus of the world right now. So it's kind of cool that I guess all these things are coming to mind. So happy to talk about that. Really excited to have this conversation with you.
Great. And what's the working from home situation set up like for you? Have you got a decent setup or?
Yeah, actually, my work from home setup could personally be a little better. My laptop is a little ancient, and I'm seeing a lot of people post about their multiple monitor situation, and I don't have that. I just working with an ancient laptop that's real clunky, but gets the job done.
Yeah, exactly. We're all kind of struggling through, I suppose, but
yeah.
Hopefully we're getting over the hill. So great. Well, yeah, thank you very much for taking the time. So for everyone listening, I kind of came across a blog post that you had written recently around the data side of the pandemic and the kind of digital health industry and how that's kind of at the forefront of everyone's conversations at the moment, with the digital health industry being in such a spotlight. So I was hoping you could just kind of talk us through that and give us, for those of you, we'll share links to it, but for those of you who haven't read it, if you could just kind of talk us through the content of what you're talking about.
Yeah, sure. So my post is essentially about the concept that data, specifically issues with interoperability and data usability, are kind of the core things that are bottlenecking the healthcare industry overall from digital health innovation. These are the things that are kind of holding the healthcare industry back 3 decades, as opposed to some other industries such as financial services that are now kind of coming into a real consumer friendly type of front. And I guess high level overview, I think essentially all the trends within healthcare, with all the stakeholders, kind of gravitating towards consumerization, digital health, the industry as a whole, seeing slow traction and slow interest from venture, from big tech, and also, the attention that coronavirus and the pandemic overall is putting into healthcare. It really makes this bottleneck even more pressing and more of a pressing issue that really needs to be solved. And these trends are kind of combining with recent regulation, namely on the American side, at least, the rules by the HHS, which are kind of enabling some of these interoperability things which could potentially result in kind of this bottleneck alleviating a little bit and bringing American healthcare at least into what we kind of hope it to be in the 21st century.
Yeah, definitely. And are you seeing the kind of in terms of the businesses that are out there within health tech innovation, do you think they're getting the kind of recognition and funding that they are? I suppose pandemic's early stage, but prior to the pandemic and now, through the other side, do you think that they're getting the recognition and ultimately the investment that they need?
I guess that kind of is like a difficult question to answer because I think it's there's a wide spectrum of types of businesses, right? On one hand, like digital health is kind of a buzzwordy thing. Like everybody wants good healthcare and really quality, like tech in like enabled healthcare, but there's a lot of companies doing it from, like not a really holistic understanding of, like how the industry works, the complexities of the industry, and just kind of like go for it without, like anticipating the complexities. And then on the other hand, there are companies that are really like doing the due diligence and like really solving the problem from like the ground up and where it needs to be. And so I think some of those, like the first, like I guess category of companies, like kind of the ones that are just like throwing a dart in the wind and like hoping it works. Those companies earlier saw some kind of traction, but then I think now like venture companies and like self-employed, not self-employed, like employers that provide self-insurance, those companies became a little bit risk averse to those companies that didn't really pan out. But on the other hand, you see like companies like Oscar, companies like Flatiron, at least on the New York side, and then, like companies like Omada in the Bay Area, like those companies are doing a lot better and like seeing a lot of like continued consistent venture interest and interest across the industry as a whole, because they're really like paying attention to like kind of like the fundamentals of the industry and like what it takes to build those things up. So that's kind of the two fronts that I think are kind of happening there.
Yeah, definitely. And how do you think that from a consumer perspective, people are going to be able to adapt to utilizing these new sort of innovations, and particularly from a data perspective, because there's so many different industries, but within sort of personal healthcare, do you think that people in America will be able to adopt these new sort of innovations? And in recognition of that, do you think that the data usage stemming from that will be utilized in the right way to prevent these bottlenecks happening in the future?
Yeah. So that's an interesting question, which I kind of touch on at some points in my, actually essentially a lot of points in my post. But essentially the industry right now is the healthcare industry is really trending towards consumerization. Earlier I talked about, like the key stakeholders in healthcare, which are, to reiterate, providers, payers, and patients, right? At least in the American system. And the providers and the payers are becoming increasingly beholden to consumers, as also consumers are also like becoming more familiar with consumerized products in other industries, such as financial services, such as retail, airlines, all these industries that are like historically terrible in terms of like their experience that they're providing. But now, like they're providing this like excellent experience for their respective industries. So consumers are demanding that type of experience also in healthcare. Also, meanwhile, like they're like spending more out of pocket, so they have increased leverage. So really, like the consumers are holding a lot more power in terms of like where they are in the healthcare pyramid, if you will. Meanwhile, also, like you have like this kind of crisis that's going on right now with the pandemic, and because of like social distancing, because of all those things, digital health is like really kind of like at this point where it's like kind of like a step function of like utilization. Before, consumers kind of thought of telehealth as potentially even a gimmick. That might be like, don't quote me on that, but I'm sure you could find some consumer report out there that was like, it's trending towards, like adoption, but not really total adoption yet. But now with the pandemic, there's a necessity to utilize those things. So consumers, providers, payers all have to utilize telehealth and other digital health services to really enable and deliver the care that they're like, that they need. And so before, where that utilization was, like kind of optional, now it's mandatory. And the longer this pandemic extends, the more it's going to extend into like habit forming behavior here, where like people are going to get used to it. People are going to get used to this new standard, and it's going to be like a step function as opposed to just like a temporary delta. And I think if that is the trend that ends up persisting, that's going to be like really, I guess, informative of how like consumer expectations of healthcare are going to be moving forward.
Yeah, definitely. I think one thing that we're seeing kind of across the industry globally is a lot of people, realizing that when we come out of this, if and when, we will,
right?
yeah, exactly. That the healthcare industry globally is going to look quite different, and has to look quite different based on that sort of mandatory adoption of these new innovations, like you said. So I think that's a really, really good point. Is there any,
and if I can add a little bit of a point there, actually, like with, at least on the American side, as I've said again, like prior to all this going down, like the HHS rulings that were recently released do really like kind of facilitate some of this interoperability stuff, with like kind of requirements around a patient access API and a provider directory API. Those things by like, some of the incumbents in the system, like providers, health systems, payers, etc. And so those things, like now being kind of required, like these incumbents need to kind of play ball and actually like connect with these digital health services. So I think there's like a likelihood that like the facilitation of this interoperability will also lead to greater digital health creation and utilization and adoption. And also, meanwhile, you get this like consumerization, you get this like, like that step function as I was talking about. So I think those forces are really converging in an interesting way. Obviously, it remains to be seen if these things play out as such, but that's kind of like what I'm hypothesizing right now.
Yeah, definitely. And I think, there's potentially a few other industries that could benefit from this, not just the digital health industry, but I think, it'll be, because it's being magnified and it's under such a spotlight at the moment, I definitely think it's going to be probably one of the first industries to, globally to have that kind of adoption happen. So, I mean, we're running out of time here, but it seems like there's some like really, interesting topics that you've talked. I mean, we could talk for hours around this.
Yeah, definitely.
How could people get in contact with you if they do have any questions or anything like that?
Yeah, definitely. Like, I love talking about digital health, like connecting with fellow health tech aficionados. Definitely, I think, connect with me on LinkedIn or like through email, which I've included at the bottom of my post. So to whoever's, I guess, listening, like feel free to connect with me through that, and happy to chat, happy to talk health tech, happy to just connect in general. So yeah, that's kind of how you can reach out.
Perfect. And just finally, before I let you go, what do you kind of want to see, what do you think, will happen, and what do you want to see from, the health tech industry globally? Is there anything in particular which you think isn't happening at the moment? Is there anything with regards to more on a government level that you would like to see happen, overall or overarching? It's a pretty broad question, but
yeah, very broad question. So like obviously a million ways I could take this, right? So I'm just kind of go with like, I guess like the first thing that like really popped into my head right now, which is that like I was talking with one of my like mentors recently, and we kind of got around to talking about the fact that like the growth of the economy is like outpaced by the growth of capital, meaning that like as time progresses, there's like income disparity is becoming a bigger threat, especially for the class that's becoming left behind. And there's obviously like tons of people addressing this in different ways, through regulatory, like through regulation, through like tech, whatever. And I would really like to see health tech and the healthcare industry really pay attention to like how like the industry as a whole can lift these people up, so that like they have their access to health, which I believe it's like pretty fundamental. And I'm also curious to see like what creative entrepreneur out there, what like creative technologist, whatever, what have you, like really kind of like solves for like the interesting business model that really gets this clicking, so that it like for the people that aren't individually incentivized to help these people, they can still like make their money, but still like help these people that are getting left behind. So I think solving for that income disparity, solving for that class disparity, especially in healthcare, I think is a pressing issue that I'd like to see the like some of these interoperability players like enable. That would be kind of cool.
Yeah, absolutely. And fingers crossed it doesn't take too long, but I definitely feel like we're on the right trend anyway. So that's great. Well, look, thank you very much for taking the time. I'll post your contact details underneath this post, and the blog post and everything like that, which really encourage everyone to read. But enjoy the rest of your day, and thank you again for taking the time.
Yeah, thanks so much, man. I really enjoy speaking with you.
And you.
So that's a wrap for us this week then, guys. Thanks so much for listening. Thanks very much to Ben taking the time out of his busy schedule to chat with us. As mentioned, there's a link to the blog post discussed in the summary of this podcast. So I encourage you really, honestly, please do check that out. If you're not going to do anything else today, make sure you check that out. But yeah, if you have any questions, you can obviously reach out to Ben through the links on the blog post, or you can reach out to me through my LinkedIn as well. So look forward to catching you guys for the next one.